from Guinta. I'm concerned about in general, about our most vulnerable citizens and community members, and in particular, their health. I'm involved in a community health center in Portsmouth that services this area as well. I know that you're well informed on community health centers, and I'm just concerned about cuts that are going to devastate us.
You know, my tenure as mayor of Manchester, I do a lot of work with community health centers. I think that they are part of the solution for access to care, particularly in high-density population areas. We did some studies in Manchester on whether we had the right number of community health centers, and it turned out we didn't have enough. I mean, we needed more. So we added one on the west side. I thought it was an important part of the delivery system of healthcare in Manchester and obviously throughout the states. We've got to be very careful when we're looking at budget reductions or spending reductions to prioritize. And not everything has the same, different items have different priority levels. If we want to make sure that we have access to care, number one, and number two, that it's affordable, community health centers are part of the solution. And they should be. I think they're very supported by the local communities. They tend to be supported by the hospitals in the community in which those community health centers are representing. And there is a relationship between that local community and the federal government. So there's some work to be done there at the federal level to make sure that the right funding levels are preserved, and that is something that I'm mindful of, particularly because I saw it firsthand. What I don't want is, a child's first grade, second grade, third grades first visit for healthcare to be the nurse at school. You want them to have that access to a community health center, and depending on the population that you're talking about, there are significant challenges. So I'd like to see community health centers be part of the solution, and I'd work on that on the federal and make sure that they're funded at an adequate level.